I can't get my ratio of 40. I'm carnivore. Any suggestions? So Melanie, I will address that. So for those of you that don't know what the ratio is, the Dr. Boz ratio is it is a measurement of your blood, measuring glucose. That is in deciliters, milligrams per deciliter, which is the American unit, and it's divided by ketones, which is in millimolars per liter. So those units are not the same. In a scientific study, you got to fix those and do some math. And I said, we're going to skip the math. We're just going to use the numbers. So it is using the same science behind where we get the protocols for improving immune system, improving, addressing cancer, the prescription strength ketone ratio to glucose ratio for seizures. And those are really advanced. When you cannot get it below 40, I will probably guess that your time of fasting is what the hardest part is. So especially if you're carnivore, if you haven't watched the lecture I did on PKD, PKD stands for Paleolithic Ketogenic Diet, and I just think of it as advanced keto or carnivore keto, except it's carnivore that's really kind of earthy, meaning you've got organ meat, we want you eating chicken skin, not so many chicken breast. Sausage is good. We really want you, the kinds of meat you eat is actually important. So if you do that already and your Dr. Boz ratio still cannot get less than 40, then I would really look at the length of time since the last bit of food. So here's a great story. So when I was doing my, I think we were in the first 4 months of doing my community group. I had a couple people show up that I knew needed help. One had multiple sclerosis, and for those of you that don't know, multiple sclerosis, their mitochondria is what's got a problem. If you feed ketones through their mitochondria, they get more and more and more efficient. So he was probably 220 pounds overweight. In the course of that year, he did lose 100 pounds, but he could not seem to fast, like it was this enemy. And so there was another woman who was trying to get pregnant. She is a teacher and wanted to get pregnant during these certain months, and she was really worried because she didn't ovulate very routinely. And again, she was keto and she was really trying to do her best, but she had this aversion to fasting as well. So I opened my big mouth and I said, I'll fast with you. We're going to set a goal of doing a 72-hour fast for 8 weeks. So at that point we had our meetings on a Wednesday, so I started them on my Sunday Night Lives and I got all the way to Wednesday, and the first few were awful. It was so hard for me. I was like, why did I say that? Why did I do that? But I really did end up with some enhancements in my numbers. Like, I cannot believe how much better I got. Like, there's another question in here that says Dr. Boz ratio of 40 is part of her every day. She says, I can't stay at 40, but I reach 40 every day. And that's what I was talking about on this podcast, about saying, if you want your immune system to improve, what we know with the Dr. Boz ratio, or with looking at glucose ketone index, is we are trying to predict autophagy. Autophagy, remember that word phagy that we talked about at the beginning, is the consumption of the unused proteins, the unused cellular parts that happen within a cell. Autophagy, much like apoptosis, which is another fancy word, but it means the programmed cell death. Your cells are going to die at a certain day. And when they die depends on how well you treat them, your genetics, cytokines, a lot of things. But once you trigger the cell to die, you can't undo it. Same thing with autophagy. Once you trigger the autophagy, you can't undo it. That cell is going to clean up all the little intracellular parts and use those proteins. So what you're trying to do is trigger autophagy as often as possible. So if you're saying, I can get to 40, but I can't seem to get below it, the first question is, why do you want to get below it? 40 is a pretty good number, and I like people doing it consistently. Personally, I fast every week to get to 40. If you go back on my Instagram page, the time spent to get to 40, I try to, if you look at my Instagram, each color is a fast. So I put my Dr. Boz ratio numbers, and it tells how long I fasted and what's my number. And I have pictures of the glucose and the ketones on my ForaCare there, and I show you those during the fast. But if you go back about 2 years I think that's not how long I've been doing this, you will see that it took me a long time to get to 40, like 72 hours to get to a Dr. Boz ratio of 40. But after I did those, it took us 10 weeks to do 8 72-hour fasts between these 2 patients and myself. And I'll tell you, it changed everything about the metabolism. So the first thing I would say is the reason you want a 40 or less is to spark your immune system to repair. We have lots of confidence that your autophagy rate will do that once you hit a ratio of 40 or less. You don't have to stay there, and in fact, I would contend eating is going to probably spark that. So it's really hard to live in an 80 or less. Now, we do this with cancer patients, and they live at 20 or less. They live at 20 or less, but they take it to such an extreme. I would ask you to watch the cancer lecture that I have out there, and at the very end, I talk about how they lower their calorie intake to 900 a day. They did that for 3 months, and you have to be under really close supervision, so please do not do that without somebody helping you. If you're doing this, go to Chronometer app, that's in the show notes as well. It's a free app, but if you ever ask the doctor to help you solve the puzzle of any malnourishment on the ketogenic diet, and you're not using something like the Chronometer app, and I don't mean something like, there is no other app out there that has such accurate nutritional data. I, as a physician, need to figure that out, and if my patient is not using this app, it becomes near impossible for me to figure it out. The apps out there aren't as well studied as what the app is for the Chronometer app, and it's free. If you want to pay the $20 for all the bells and whistles, the $20 lasts you a year, or maybe it's 25. But the point is, really, really good data is how you solve that. If you're trying to use the ketogenic diet with a cancer protocol or with a seizure protocol, please be under supervision. And then if your doctor doesn't know about the Chronometer app, teach them by using it, because you will be able to solve it. You'll see the deficiencies. And the way you see them is you have to be able to trust the data behind the app, and that's what that Chronometer app does. So let me wrap up that question, and then I'm going to call it a night or a day. It's a night for you, but day for me. And that is Dr. Boz ratio of 40 or less. If you hit it, that's the goal, to spark your immune system to replenish. You're really getting the cells to recycle and getting, maybe you can say, the weaker ones to die off and the healthy ones to replicate. This is the way that you're going to regulate those cytokines. You gotta measure. Do not play with this. Order the ForaCare below. Use the promo code if you want a little discount. But doing this blind, it's too variable. Every patient is so different. They have to check it. And then having a Dr. Boz ratio of 40 every day is really healthy. I mean, I can't do that. I mean, I don't want to do that. That's too restrictive. I would have to slow a lot of things down, and my husband would probably go on strike. But the last question that I've been staring at to try not to scroll past it is, how do you eat to build muscle? And there is a really good video that I made on building and protecting muscle by measuring and being in a ketogenic state as you do it. And it's the data is from Ryan Lowry's team on the Applied Science Performance Performance Institute, and really good study on building muscle on a ketogenic diet. This is where I send people when they say, "But doc, I don't want to lose weight." I'm like, it's not about the weight. It's about what's going on in your metabolism. It's about what your cytokines are doing. It's about how your cells are replicating. And that has everything to do with your mitochondria.
Please subscribe to my channel. And don't forget to click the notification bell so you don't miss out on any new videos. Stay tuned.